Types of minor connectors. Uh, minor connector which joins the clasp assembly to the major connector. So now in this, the clasp assembly. This is your simple circular clasp or the C clasp. This clasp is connected to your major connector, and so this in between the part is actually your minor connector. And also which joins the indirect retainers or auxiliary wrist to the major connector. You can see this, it is not attached to any other clasp. It is an auxiliary wrist or an indirect retainer. So this is a wrist. Also, this is your minor connector. So this wrist is connected to your major connector with the help of your minor connector. And then the other joins the denture base to the major connector. So this is the area which is going to be later be replaced with the denture base. This is also a minor connector. This minor connector is going to attach to your major connector. And next is your, it serves as an approach arm for the vertical projection or bar clasp. If you see this, this is your gingerly approaching clasp or a bar type of clasp. So rather than occlusally approaching, this is your gingerly approaching. So this is also your minor connector. This is your retainer, whereas this is your minor connector and this is the major connector. And when we talk about this wrist, it is basically the wrist is a component of RPD that serve primarily to transfer the forces occurring against the prosthesis down to the long axis of the abutment tooth. And for that, to place a wrist, we are going to prepare the area in the tooth, which is called as a wrist seat. So this is a prepared recess in the tooth or restoration created to receive the occlusal, incisal, cingulum, or lingual rest. So now if you see this, this is the wrist. This is also going to be either a part of your clasp assembly or it can also be your auxiliary wrist. So we can see the placement of the wrist here. All the occlusal forces are going to be directed along the long axis of the tooth. So thereby having all the other parts are going to divert their forces towards the wrist. The wrist takes the support from the tooth. There are different types of wrist, the primary wrist and the secondary wrist. The primary wrist, as I told you, it is the component part of the clasp assembly. As the secondary wrist, it can be an additional support or an indirect retention. The primary wrists maybe they prevent the vertical movement of the prosthesis towards the tissues and also help the transmission of lateral and horizontal forces. The secondary wrists are used as indirect retainers in distal extension partial dentures. Different forms of wrist includes the occlusal wrist, the cingulum wrist or the lingual wrist, the incisal wrist, based upon their location. So now this is the wrist which is going to be placed over the occlusal surface of the tooth. So it is the occlusal wrist. And if you see, this is the wrist seat prepared where the wrist, this is the cingulum wrist.